The inferior mediastinum is divided into the anterior, middle and the posterior mediastinum. Right? You can see the anterior, middle and the posterior mediastinum. The anterior mediastinum we've already spoken about, right? We have done about the boundaries and contents also, which come to the middle mediastinum. It is occupied basically by the pericardium and the contents along with the phrenic nerves and the pericardio-phrenic vessels. Boundaries. Anteriorly, we have the sternopericardial ligament. Posteriorly, we have the esophagus, descending thoracic aorta and the azygous vein. On each side, it is bounded by the mediastinal pleura. Contents: heart enclosed in the pericardium. The arteries are the ascending aorta, the pulmonary trunk, and the two pulmonary arteries. Veins: the lower half of the superior vena cava, terminal part of the azygous vein, right and left pulmonary veins. The nerves include the phrenic nerve in front, this is the phrenic nerve, and the deep cardiac plexus. We also have the tracheobronchial lymph nodes over here as the contents. Now let's come to the posterior mediastinum. First, the boundaries. Anteriorly, it is bounded by the pericardium. Posteriorly, by the bifurcation, and also we have the bifurcation of trachea, pulmonary vessels, and the posterior part of the upper surface of the diaphragm. Posteriorly, the lower 8 thoracic vertebrae and its intervening disc from T5 to T12, and on each side bounded by the mediastinal pleura. Contents. The contents are esophagus, the arteries, that is the descending thoracic aorta and its branches. Veins, we have the azygous vein, this is the hemiazygous vein, and then the accessory azygous vein. This is the accessory hemiazygous vein, sorry. Nerves, we have the vagi, then we have the splanchnic nerves, the greater, the lesser, and the least splanchnic nerve arising from the lower 8 thoracic ganglia of the sympathetic chain here. Lymph nodes and lymphatics. Posterior mediastinal lymph nodes are lying alongside the aorta, and then also we have the thoracic duct here. So you can see over here the descending aorta, the azygous vein, the hemiazygous vein, and the accessory hemiazygous venous system. That is the content of the posterior mediastinum. Now, the clinical anatomy, the prevertebral layer of the deep cervical fascia, right? This is the vertebral column, the layer in front of it. Since it's the prevertebral fascia, you can see over here, extends into the superior mediastinum and is attached to the 4th thoracic vertebra over here. So an infection presenting in the neck behind this fascia can pass down into the superior mediastinum but not lower down. Then the other fascia is the pretracheal fascia of the neck. This is the trachea. Here is a pretracheal fascia. This is the larynx continuing with the trachea. So this is the pretracheal fascia that is in front of the trachea of the neck, also extending up to the superior mediastinum, where it is blending with the arch of aorta. So neck infections between the pretracheal and the prevertebral fascia can spread into the superior mediastinum and through it into the posterior. Can spread into firstly the superior mediastinum and through it into the posterior mediastinum. So, mediastinitis can result from the infection in the neck. Now, there is very little loose connective tissue between the mobile organs of the mediastinum. Therefore, the space can be readily dilated by inflammatory fluids, neoplasms, etc. In the superior mediastinum, all the large veins are on the right side, as you can see, and the arteries are on the left side. During increased blood flow, the veins expand enormously while the large arteries do not expand at all. There is much dead space, therefore, on the right side, and it is into this space that tumors of fluid of the mediastinum tend to project. Right. So, in case of this projection onto the right dead space, there could be compression of the mediastinal structure by tumors, giving rise to some symptoms together called the Mediastinum syndrome. Now, the common symptoms are obstruction of the superior vena cava, that is giving rise to engorgement of veins in the upper half of the body. Pressure over the trachea causes dyspnea and cough. Okay. Pressure on esophagus causes dysphagia. Pressure on the left recurrent laryngeal nerve gives rise to hoarseness of voice called dysphonia, and pressure on the phrenic nerves causes paralysis of the diaphragm of that side. Also, pressure on the intercostal nerves giving rise to pain in the area supplied by them causes the intercostal neuralgia. Pressure on the vertebral column may cause erosion of the vertebral bodies. The common cause of the mediastinal syndrome are the bronchogenic carcinoma, Hodgkin disease causing enlargement of the mediastinal lymph nodes, aneurysm or dilatation of iodine.